Hello, everybody. Good afternoon. My name is Ammad and I'm the Business Development Manager at Evaluate Medicolegal. So, a bit about myself. I work closely with insurers, law firms, and healthcare providers to support high quality occupational and medical legal assessments. So, our topic for today is occupational and functional assessment services for SIRA and CTP claims in New South Wales. I have a co-speaker today with me. She's a very senior physiotherapist, Ms. Shraddha Patel. I'll ask her to give a brief introduction about herself as well before we move forward.
Hello, everyone. My name is Shraddha Patel. I'm a physiotherapist, graduated from Sydney University in 2009. I have over 1.5 decades of an experience in rehab and musculoskeletal field as a physiotherapist. I'm a SIRA provider covering therapy assessment, education, and training. And I'm a approved provider for similar scheme in Queensland and Victoria. In Victoria, I am registered as an independent physiotherapy consultant with TAC. And in NSW, I'm registered as a health practitioner authorized to give evidence in court and other dispute resolution proceedings for CTP scheme. With Evaluate Medicolegal, my role is more of an assessor for detailed functional capacity evaluations. Above all, I love providing therapy, and I continue to serve as a therapist in my Westmead clinic. Back to you, Ammad.
Thank you so much, Shraddha, for the brief introduction. Moving forward with the webinar today, next slide. To start with, it's important to understand why occupational and functional assessments have become so critical in the SIRA and CTP environment. So across New South Wales, the expectations around clarity and quality have significantly increased. One of the biggest shifts we see is that decisions are no longer based on purely diagnoses. It's not just about what the condition the worker is in, it's actually about what they can actually do. So in reality, many reports fall short. We often see poor linkages between clinical findings, previous treatments, and therapies, and actual functional capacities. So while the medical history may be accurate, it doesn't clearly translate into what the person can actually do or cannot do. So when this gap exists, it leads to a number of issues and problems. For example, delays in claim matters, disputes between stakeholders, and ultimately financial impact across the systems. So yeah, the system doesn't need actually more reports. It needs better ones. The reports which are clear, functional, and actually support the decision makers. Next slide.
Okay, so I will talk more in detail about functional assessment and the structure of the report. And this plays a key role at Evaluate. Independent functional assessment plays a critical role in clinical outcomes, claim decisions, and overall credibility of medical legal reports. Now, this assessment helps to bring the focus back on ability. And during the assessment, I identify musculoskeletal factors contributing the activity limitation. And then there is a genuine effort to create awareness in patient during the process of assessment. Now, this is not just done merely through discussion. It's done from very beginning of the assessment via activity trials and feedback cycles. And the analysis is also done for the history of conservative therapy and self-management strategies, including home exercise program, because this gives us a holistic view of what is already been in place and to what extent has it worked or didn't work. And then recommendations are made depending on the performance. So basically the average performance is seen through all these above ground level of biomechanical awareness, past intervention, current self-management strategies, and clients' goals. Now, the word independent here is really important. I have been I have been in this field for a while, and I have done functional capacity assessment both as a therapist of the patient and also as an independent physiotherapist. And there is a big difference when independent physiotherapist does the functional assessment. The relationship is very neutral, detached, and versus a supportive and collaborative relationship that client has with their own physio. So the outcomes are different. And again, the process is such that there are no surprises. Client goes through a lot of psychological and physical reflection on their part when we do the assessment. These are the assessments which we do in repetitive manner under clinical supervision. So usually we start with standardized assessment tools for screening, and we screen for pain, confidence levels, perceived impact on their daily functions. And so this is more of a psychological analysis where we understand how client understands about their injury and functional ability. And then up to objectives, sitting, standing, walking, stairs, lifting from various positions, push-pull capacity, carrying capacity, past therapy assessment, home exercise program assessment, identifying barriers for the return to work and recommendations to address these barriers. Also further therapy recommendation with frequency and duration to facilitate further improvement in the capacity. Now, each of the function that I have stated above, like sitting, standing, or lifting, I've just given a little example here of the squat function, ability to squat down, and see how we break down the task in like how much time was allocated to perform the task, how many repetitions were done, what were the reported symptoms from the client, what was the observation of assessor, or if there any self-management strategy used during this performance. So the report is very detailed when it comes to capacity, because there are always clients who can perform certain tasks but not on repetitive manner or not safely enough or may not have good manual technique. So everything will be documented and recommendation will take account all these information. Next slide, please. So I'll take you through now a case study. So this is Miss M, 40-year-old lady. She injured her both knees and right ankle in motor vehicle accident in mid-2024. When I saw her, it was end of 2025. And she was afraid of this assessment because there was hardly any functional capacity there. She did not see a point of having this assessment because of pain. Now, I went through, so this is really important that we go through all the previous or latest capacity certificate, allied health treatment request, report of pain specialist, if there is any IME or IMC report. And this lady had over 1 year of bi-weekly physio, and her latest capacity showed 15 minutes capacity for sitting, standing, and walking, and 0 lifting capacity. And her scans also, we went through, suggested right ankle partial thickness tear of some of the ankle ligaments. And I haven't noted here, but there was worsening of existing knee soft tissue injury. So, and she also had developed deep venous thrombosis, which was just resolved before her appointment with me. Now, she was also unable to recall her home exercise program. As she mentioned, she could not do exercises independently. So this was the state when I saw her, okay? And after a couple of hours in functional capacity evaluation, she realized that she was able to sit, stand, and walk for at least 30 minutes. And this was indoor ability. She was able to, by implementing stretch breaks, she can extend this time by 2 hours. She also understood secondary pain in her lower back and neck can further impact her functions if she continues to rely on passive therapy. And one of her favorite passive therapy was putting her legs up against the chair. So just imagine, like, if you are listening me and if you are sitting in the chair, if you have something ahead, another chair in front of you, if you put both your legs up, right? And in this case, for her to reduce the swelling in her ankle and a knee, sitting in that position for over an hour can really give a bad pain in the back because all your body weight now is on your tailbone or your lower back. Now, when I explained her further, and there were a few more things she was doing in similar manner, she understood how all these other pains are now developing in her body are addressable. So anyways, she agreed to participate in exercise therapy trial. She was also made aware of importance of goal setting with her current therapy provider. And usually goal setting is done always from the beginning, but sometimes goals are not realistic for clients. And sometimes they're not sharing it with their therapy provider. So this was also further explained how the goals could be small and achievable. Well, she left home with around 6 key exercises for major muscle of her leg in supine and prone positions. And she was able to do it on her own. And her return to work queries were addressed in detail. Her doubts were addressed. She was made aware that there is a sense of choice when it comes to finding suitable employment. I also explained importance of rehab provider. So her summary of her functional assessment included clear capacity for her nominated treating doctor, recommendation for her current therapy provider regarding goal setting, and then possible transition to exercise physiologist in certain time frame. So the whole the process was able to put this case forward, move this case forward.
Thank you, Shraddha. So building on that, let's look at where most assessments fall short in the current systems. So starting off, report structure is often an issue we face nowadays. Key information like capacity, restrictions, and recommendations is either unclear or buried with long narratives. It actually makes it very difficult for insurers and lawyers to quickly interpret them. This also makes they may describe the injury well, but they don't clearly address work capacities in the way decision makers actually require them to do. Another major gap is the disconnection between the clinical findings and the functional capacities. The diagnosis may be accurate, but it doesn't clearly explain what the person can actually do in the real world environment. Reports often don't answer the questions clearly. For example, can the worker return in what capacity and with what specific restrictions? So in many cases, there's also limited insights into recovery timelines. There's no clear indication of how the condition is expected to progress or when the reassessment should occur, definitely. So overall, the issue is not about the lack of medical input. It's actually about the lack of clarity, structure, and functional relevancy. The next slide. So I'd briefly like to explain how we cater this gap at Evaluate Medicolegal. So occupational physicians are specifically trained to bridge the gap between the clinical pathology and workplace demands. Our reports are designed to be easy to interpret with clear summaries of capacity restrictions and recommendations. We also provide forward-looking insights. This means that our reports includes expected recovery timelines, how capacity is likely to progress, and when the reassessment should be occurred. And most important of all of our opinions are evidence-based and well-reasoned. We ensure that every conclusion is supported by clinical findings, which definitely makes the reports far more defensible in both the insurer and the legal settings. So overall, our focus is not just on producing reports, but on producing reports that are clear and functional. Next slide.
Yeah, so let's have a look at the report summary of one of the functional capacity evaluation report. Now, as Ammad said, the clarity is really important when it comes to especially capacity. And here, the way we put it out is this already is discussed at the end of the functional capacity assessment. So there is a work hour possibility of 4 hours a day, 2 days a week, seeking a new employment. All this information is clear. How much sitting this person is able to tolerate, how much standing. And when the tolerance rating are rated as per occupational guidelines. So here you can see reduced tolerance means less tolerance than their pre-injury state. Limited tolerance, that means person is able to do it, but not for more than 3 minutes or not on a repetitive basis. So these are how, lifting, how many kilograms, driving. So this is how the report summary looks like. And there is also a recommendation given. If you go to the next slide. So this is how, let's say, in case of Miss S, just a second, guys. Yeah. Continue with pain management. So what therapy to be continued for how long? For another 2 months on weekly basis. And there should be a goal to wean off from passive therapies, move towards active therapy, with all these criteria in mind to improve confidence in walking, stairs, squat. And then again, another recommendation that active therapy input is mainly needed for lower limb strengthening. There's also, I have mentioned here that current therapy involves manual inputs like a massage therapy, or where the time period for passive therapy can be shortened slowly, and active therapy like safe exercises this time can be gradually increased. So eventually a complete transition to active therapy can be done. I also sometimes provide safe exercises in the reference section of the report, where it can act as a guide for therapy provider, and then transition to exercise physiology is recommended after 2 months. And we also put this forward to rehab provider in case if there is any other assessment like a new employer return to work services required. So the recommendation looks like these, and obviously it will change depending on case to case. But yeah, let's go ahead to the next slide. All right, so let's talk when to refer for functional capacity evaluation. Now, it's helpful in different stages for progression towards modified or pre-injury duties. And it's done mainly to confirm the functional ability, making sure the return to work happens in a safe manner. In medical legal settings, functional assessment can also be done to find out cause behind poor work capacity or to aid the evidence for current capacity. But yeah, in general, whenever the recovery is delayed or when the return to work is under plan or there is any uncertainty or dispute, functional capacity can also actually be done in early stages. Let's say a client had 5 months of therapy already, 6 months of therapy. It's a good idea to get a detailed functional assessment done so that a capacity of certificate can reflect true capacity. And yes, it definitely helps to determine return to work prognosis and time frame. Next. Yeah, so who can refer? The insurer, definitely. CTP and SIRA, workers' comp injury clients. So all the insurer catering, work injury and motor vehicle accident can definitely refer. Lawyers can refer for, of course, for work injury client, motor vehicle accident, also medical negligence or public liability cases. And also second opinion can also be gained from this referral. The doctors who are who are acting as a nominated treating doctors or surgeons. And of course, functional capacity assessment is done across NDIS and aged care sector. Employer can also refer for fitness for duty or OHS or occupational health and safety compliance and duty of care as a part of duty of care. Now, there are no special forms are required, although pre-approval is required from insurer before we carry out the assessment or before we book the client in, because the time length may vary from case to case for this assessment, as they are pretty lengthy. And we do expect copies of the scan results, latest capacity of certificate, allied health treatment request, and also any other report from various therapy providers, surgeons, any IME or IMC reports. So basically, more the information given, better the quality of functional assessment. And yeah, so these documents should be provided at the time of referral. Yeah, let's go ahead. I'll just get out.
Yeah. So thank you, Shraddha. So why partner with Evaluate Medicolegal? So bringing everything together, when assessments are done properly, the impact is not just clinical, but it's financial and operational as well. And that's what we provide at Evaluate Medicolegal. So like Shraddha told us earlier, doctors, insurers, lawyers, and businesses can refer to us. So for insurers, we provide clarity when reports clearly define work capacity and functional limitations. It's actually easier and it's easier and it leads to more confident decision makings. Obviously, for the employers, we provide practical return to work guidance. These are not just recommendations, but these are clear directions on what the worker can do and what restrictions apply onto him and how to safely bring back him or her to the workplace. And obviously for the businesses, it comes down to reliability. We provide consistent, high quality assessments, which are actually delivered on time with clear communication throughout the process. So at the end, I would just like to say it's not actually just about the reports. It's actually about making decisions easier for everybody involved. Thank you. Looking forward to our next webinar next month with a new speaker, new topic, and exciting information. Thank you everybody for joining in. See you all next month. Thanks. Bye.